Hi, Dr. Mike from Anderson Family Chiropractic. You know, something that parents ask me a lot after I explain what chiropractic is to them, they want to know, well, how did my child get a subluxation? And subluxations are the misalignments that occur within your spine that interferes with the information that's coming from your brain down your spinal cord and out through your body. So it's preventing your body from functioning properly. And the answer is there's a lot of different ways that children can get subluxations. The very first way is from the birth process. If there's any type of twisting or pulling that's taking place on the child's head and neck, then that's very likely the cause of the very first subluxation. Now this can happen a lot of different ways. If there's any type of intervention like C-sections or especially vacuums or forceps, obviously there's pulling and twisting with that. Or even if it's just a natural delivery and the doctor just pulls or twists just a little bit, it doesn't take much just to cause that very first subluxation. And when you have subluxations, now it's going to prevent the body from functioning properly. So maybe the baby will end up having things like colic or trouble breastfeeding or a poor immune system. All these things can be from subluxations and the body unable to function properly. So that's what we do as chiropractors. We look for where these subluxations are taking place and then we correct them. Now other ways that subluxations can occur are when the child gets a little bit older and they're starting to learn to walk and crawl, and they have multiple falls. Obviously those falls can cause subluxations. And then beyond that is coming from when the body is unable to adapt to stresses that are placed on it. So stresses come in different forms. Obviously there's emotional stress, and people will say, well, does the baby really even have emotional stress? Obviously if the baby's crying a lot, or if they feel that their needs are not being met, then it's going to be having some emotional stress. So that could be causing some subluxations. And then the final way is through chemical stress. And chemical stress is just when there's anything that's unhealthy for the baby that's either taken into their bodies or put onto their bodies, because all those chemicals that get put onto their bodies can be absorbed through the skin and then affect their health. So ways that can happen is if the baby has any medications that they're taking or any lotions or anything that's got a lot of chemicals in it. And also you have to look at what the mother is doing, because if the mother has medications and they're breastfeeding, all that can get sent through the breast milk. And also if the mother has a poor diet, that can be transmitted through the breast milk. And also if the child is using formula instead of breastfeeding, then whatever chemicals are in that formula, the baby's going to be taking it, and that can cause stress on their bodies. So there's a lot of different ways that children can have subluxations. So if you're interested in finding out if your child has subluxations and it could be affecting their health, give us a call at Anderson Family Chiropractic, 616-735-1920. Thanks for watching this video and have a great day.